Today, I'd like to give you a small message with regard to what kind of activity you need to do and how it's going to influence your diabetes profile. The most simple and best form of exercise is do a daily walk. How much of walking will help you achieve good control? It's all in your hands. If you walk quicker and reach a good heart rate, so when you increase your pace, you reach a good heart rate. Usually that is the kind of a walk, when you're sweating, that is the kind of walk that gives you a good change in your diabetes profile. Points to remember when you go for your walk: make sure that you're not in a low level of blood glucose, because after a high intensity walk, your further sugars can dip further. So remember to eat a nice, proper, healthy snack before you walk if you have your sugars are already on the lower levels. And walking for a minimum 30 minutes with high intensity is good enough. If you're planning to lose weight, walk for about 1 hour with high intensity. You will surely achieve your goals. Few things to remember when you are dealing with diabetes. The most important aspect in your diabetic profile is to follow a regular pattern. Why this is important? Because the body does not like variations in its when the physiological variations, that if there is too much, it kind of affects the body quite a lot. So this is called glucose variability when we are starting to see it in your diabetes profile. Highs and lows. So how do we prevent such kind of variability? When it comes to lifestyle, it is very simple. Follow a meal timing, take your tablets or insulin on time, whatever has been prescribed, and also not skip meals and go to bed at a fixed time. When you follow a regular pattern, the body gets used to this pattern and it knows exactly when to expect what. So your profile variability comes down when you follow these clean and good habits. Today I'm going to be talking of a secret ingredient in your food and why this is the most important aspect when you eat food. Quite a lot of people, when we talk about diabetic diet, they're extremely scared that they cannot eat their favorite food. Like for example, I love eating rice, but as a diabetic, you know, you've been hearing a lot of information that eating rice is bad for you. No food item is bad for you when you take the right quantity. And very important, when you're eating carbohydrates, the secret ingredient that can keep your sugars low with carbohydrates is fiber. Fiber comes from your vegetables, comes from greens, and this, when combined with a small carb load or medium carb load, depending on how active you are or how big your personality is, helps keep your sugars down. So always combine your carbohydrates with good amount of fiber. Around 10 to 15% of your meal should be fiber. And doing that with some amount of protein and fat gives you a great profile and a good balanced meal. Today, I'll be covering a couple of topics to help manage your diabetes much better. The main focus of what I will be speaking to you today will be regarding lifestyle. To start off, the most important aspect of any lifestyle related problem in diabetes will be your diet. So when it comes to somebody with diabetes, the right kind of diet should be a balanced kind of diet. Most of the time people get confused when they have diabetes, what to eat and what not to eat. Keeping in mind few rules, you will help get your sugars in control more quickly when you follow your diet much better. So, what is the simple rules that you should follow? 1. Restrict your carbohydrates. So, what is carbohydrates? Carbohydrates are basically starches and sugars that are there in your food, and most important foods that we consume are wheat, rice and ragi, and certain other parts of India we also consume corn as part of our staple diet.